All right, and we're live. Good day sa ating lahat. I'll just introduce my guest for today na syempre alam niyo naman na he was my tennis partner. Ang galing niya. He's one of the cum laude of his batch. Legit cum laude 'to, hindi gaya sa amin na ang daming pages of cum laude. Sila kung cum laude talaga, talagang magaling, eh. Balita ko malakas din ang kaniyang ma malakas din ang kaniyang sex appeal. Kapwa ko daddy na ngayon. Happy Father's Day, belated kuya. Kuya Robert Angelo Gomez. Hi,
Hi,
hi kuya.
everybody. Hi, friends. Hello,
Alright.
everyone.
So we just started the kwentuhan off cam and I think we're on a good mood now to start this live kwentuhan with you guys. Alright,
Yes,
so on the first
okay.
note, mga gusto mong batiin muna, Kuya Rob.
Oh, sure. Yes. So, welcome, everybody. I can't see everyone now, but my name is Rob, and I am an SLU graduate of School of Nursing. If you notice that I have an accent, it's because I was actually born in Canada. Born in Canada, lived in the USA, and then nursing school in the Philippines, and then back to Canada.
Yun, yun. But note that you also worked in the Philippines, right?
I did. So
Oh,
yeah, I want to mention how when I first started working there, I can share a story how I can share a story about uh my first few weeks of orientation. I'll start
mm-hmm.
with that. So when I first started working at the medical city, I uh, was originally opted to go to emergency room.
Also, you
But
don't choose. They
yeah,
choose it out for you.
they chose that for me.
Ah, okay, okay.
But I chose for ICU instead. And the reason, and I asked, oh, do you have ICU? Meron ba kayong ICU experience or ICU vacancy? And they said yes. And I
Oh
took
wow,
that. And the reason
that's so
why,
bold. Ang
and the
tapang
reason,
mo
yeah,
naman.
as the first job, I really want to take it. And the reason why, and I want to give a shout out to Sir Galanza. He's the one that told me.
Oh, okay.
He told me in class, I remember this story. Uh, I don't know what we were doing, but I think it was some sort of personality test with the nursing
Mm-hmm. Okay.
careers. And then he said, Rob, I think you can be an ICU. And then, of course, syempre, maganda yung feeling na yan. Like, oh, yeah, very boosted confidence, very, like, inspiring. So I always held
Mm-hmm.
on to that idea. And and then from then on, I never really let go of it. Kaya gusto ko talaga mag-ICU that time. And so I went there and yeah, I was really enjoying it talaga. Lots to learn. I learned a lot about Philippine healthcare system, syempre, kasi
Mm-hmm. Yeah,
now that I'm here in Canada, I have an idea of how to compare both.
you can compare it.
I can compare both.
Yeah.
It has both have their pros and cons for sure.
Mm-hmm. For
Both
sure,
do
for sure.
have their pros and cons. Um,
So,
but yeah,
I just
mm,
wanna emphasize that the one who told you about that you want you're compatible on ICU is not just regular CI, right? I think it's our fourth year department head and he's
oh,
di ba?
I think
Kaya
during the time he
bigatin
was
siya eh,
our
bigatin.
clinical coordinator at that.
Oh yeah, di ba?
But
So hindi
I'm so happy
basta-basta,
for
di ba?
him. Yeah, I'm so out of the loop. I haven't worked there since because I also worked there. I also worked with them from 2021 May
Oh
to
yeah, I
June.
think
May
I
to
remember
June.
you now.
Yeah.
I remember you now. There.
Yeah. It was really nice. It was really nice seeing because kasi 'di ba when we were for fourth years, you were first years, right?
Yep.
So, ayun. You guys were not very much older. I mean, I was already older when I first entered, pero
Yeah.
that's beside the point. But going back and then seeing you guys as fourth years now, and then it was really nice to see it. It really sparked something as like oh, maybe I can be a teacher one day, a CI one day, who knows?
How
Actually,
was
I
your
still do. I still
experience?
have that idea, huh?
How's your experience
As CI?
as a yeah?
As Oh, I loved it. Yeah, I really enjoyed it. I really enjoyed helping students learn, helping
Mhm.
students enjoy nursing. It does not have to be just a job. It does not have to be just a career. It can be
Mhm.
something that you enjoy. And I think it all stems from it really, there's a good reason why Filipino nurses are so good. It really stems from the heart of the Filipino, which is the compassion. Yung malasakit, right? That's the
Oh
best
yeah.
part.
Tama,
That's the
tama.
best part of the nursing care. So it's good to inspire that fire inside them. And then sharing the knowledge as well is also a good way. And so, I still carry some of my teaching to here
Mhm.
because sometimes I'm asked to be a preceptor
Oh
for
yeah, yeah.
nursing
For
students that
new
are doing yung OJT nila. Their
uh-huh.
placement is what they call it here. They call it placement here,
Mhm.
but it's basically the same as their duties.
Yeah.
And then
Okay.
yeah, it's more of a one-on-one experience teaching, and then also for new hires, new employees that
Yung
also
bagong
require
pasok.
precept. Oo, oo. So
I have a
yeah.
question, Kuya
Mm-hmm.
Rob. When you got in SLU, was it hard or they were looking for teachers so they just absorbed you inside?
It was a bit okay, I will admit it was only easy during that time because of COVID.
Oh yeah.
COVID was like a great reset for careers. Everybody just quit. I know in Canada, everybody just quit. No one cared anymore. Everybody was about their safety, their health, their
Mhm,
own health
mhm.
and safety.
Especially the older
Uh
nurses, right?
yeah, especially for our older nurses, our nurses turning 60, 65,
Oh,
55, a lot of them went to early retirement. Some nurses were even asked to come back from retirement. They're in their 70s. They're asked to come
oh,
back.
yeah. Shortage.
The shortage, yes. So during that time in 2021, everything was still fresh. So they were looking for, I think I actually received a text message or email, like just
From
very,
SLU?
yeah, from SLU, the
Wow!
administration, just like, oh,
They're
you're our
interested.
alumni. Do you want to work? Long, just kind of, just
Parang
kind
same
of,
kayo ni Kuya Nasser, tine-text kayo,
oh, just like texting. It was great. I loved it. I loved the fact that it was just texting, and it felt so informal, but I think that was the best part. And then and then yes, I accepted because there's a reason why I accepted. I'm not trying to like, TMC is a great hospital, of
Mhm,
course.
mhm.
I want to put that out there. TMC is a great hospital. The policy though is that I can share a little bit about something because the policy is that you have to work there for 1 year to get your benefits, your medical
Oh, yeah.
benefits.
So
And I
TMC is,
was
the
oh
medical center, right?
the
The medical center
medical
in
city in
the medical city
Clark,
in
Medical City
Clark.
Clark. Yeah.
Okay.
Um,
And then after the 1 year, you'll get your
excuse me.
benefits.
Yeah. So after 1 year, I actually was 2 weeks away from getting my benefits.
Oh.
Um, what happened was, because it was COVID, I actually caught a fever. It was very strict. I was picked up by TMC ambulance, taken to TMC, did
Oh, yeah.
the
So quarantine.
uh, did the PRC testing, was in quarantine at home, and then I was negative. I was negative, but they asked me to do a chest X-ray.
Mhm.
And the funny story is, I was diagnosed with radiologic tuberculosis. So I
What?
have a yeah. So I did the sputum. It was negative. So I was not diagnosed by by the culture,
Testing.
by the
Yeah.
sputum testing, like in traditional sense, I was
Mhm.
diagnosed radiologically. However, some of my teachers already know this. I had pneumothorax back in 2016. So
Oh, what happened?
some of
What
my
happened?
2016
Spontaneous?
pneumothorax, spontaneous.
Mhm.
Yes, it
Okay.
just happened in class. I think, yeah, I got sent to the clinic. The uh, the on-call no, it's not on-call, but the staff
Oh,
physician
so you
there
were
said
at
I was
class, right?
okay. Huh? Oh, I was in
During
class.
class, it
I
happened.
was in class. I was just sitting in class listening. I don't know whose class it was, but all of a sudden I felt
Mhm, mhm,
the squeezing pressure on my left side. Yeah, left side. And
mhm.
then I just felt like I couldn't breathe. I couldn't sit up straight. Shortness of breath, dyspnea, you know.
Yeah, oo,
Very
lahat na 'yan.
common, very typical signs.
And then
Then,
what happened after you were
oh,
diagnosed
after that,
radiologically?
I was very pasaway.
Or
I was very hard-headed
oh,
because like I almost died basically because just
mhm,
because of
mhm.
my stubbornness. I They did the chest X-ray. It was actually a incidental finding because it was just
Yeah,
in
yeah,
time for
that's
the physical exam. So literally the same time that I had the pneumothorax was the same time of our physical exam. And so they caught it. I was like, "What the heck is this? What in the
mhm,
world is this? You have a pneumothorax. You need to go to the emergency room." So I went to SLU ER. I went to SLU ER, and then yeah, they said that I need to be admitted. But I was so type A with my studies. I was so focused on
mhm.
my studies that I actually pretty much signed AMA against medical
Yeah,
advice,
yeah.
and I withheld treatment for 3 days because I wanted to finish my rotation. Like, if I'm going to get sick and be in the hospital for 4 days, I may as well just finish this rotation and then miss out schoolwork, the lecture. I'd rather just be absent for the lecture. Uh, so I waited 3 days. I did a second opinion at BGH. Yeah, yeah,
Mhm.
Baguio General, I think. Yeah, Baguio General. Second
Yeah, Baguio
opinion.
General.
This time, worsening symptoms. I have medial spinal shifting. My heart is
Mhm,
being
yeah,
placed onto the right side,
yes. Mhm.
and then I have 50% pleural effusion.
Oh,
So I'm like, oh my gosh,
oh,
this is
no.
an emergency. Yeah. So what are the risks of pneumothorax? Of course, with tamponading, like, oh my gosh,
Oh,
it's
yeah.
like if we tamponade, this is such cardiogenic shock already. So
Yeah.
like, I don't want to get into cardiogenic shock when I was there. So I finished. I finished the rotation. You know what was really fun too? I was with my colleagues, with my batchmates at the time. They were doing the
Uh-huh.
tests, the palpation test
Ah,
for equal
you're
lung
the guinea pig.
extension. I was the guinea pig. They see it go like this only. They see it only go like this.
Oh, yeah.
So it was a fun learning for them. And then I got admitted. We did chest tube insertion. A
Mhm.
large bore, not pigtail, large bore chest tube insertion on the I believe it's on the second ICS.
Oh,
Mid
second, that's
second
high.
ICS,
You're sitting. Are
mid
you sitting
axilla.
or
I was lying down. I had local anesthesia.
oh, like that?
Local
Yeah.
anesthesia. I was
That's
awake.
bedside, right? They
Um,
do it bedside.
no, no. I think in Philippines, for me at least, it was OR. But I know in some
Oh, hindi,
emergency
oo.
situations, they would just do it at the bedside.
Oo,
But
they
they would
just do
probably
it
just
in
do it in the
bedside in my
ER if it was
experience.
here. Oh, if it was here, they would probably just do it in the ER. They wouldn't even wait. you
Uh-huh,
know,
uh-huh.
and then they would send
Alright.
me out. But I was
Okay,
spoiled enough
kuya,
to get
e
the OR.
eto na, oh. Oh, may mga nagha-hi na sa'yo. Let's shout out, Ma'am Joyce Kiatong. He says, "Hi,
Hi.
Kuya Rob," and Ma'am
Hi,
Cherilyn
ma'am.
Dalilis.
Hi, ma'am
Nice
Delilis.
seeing
Hi,
you
ma'am
you
Cal.
both.
Oh, it's good to hear from you.
So, those both are our CIs back then.
Oh yeah, always lovely to hear from them. Of
Kuya Rob,
course.
can you move your camera to your right
Oh yes,
a
yes,
little bit?
yes. How's
Oh,
that? Is
yeah.
that better? Oh, I'm so sorry. Here
Yep,
we go.
that's better.
All
All
right.
right.
Okay.
So
Okay.
we have introduced Kuya Rob, and I just want to ask, why nursing? Although you're from Canada, and especially when you ask Filipinos going abroad, number one thing is their nurses, especially in
Hmm.
the US, Canada. So why did
Hmm.
you particularly choose nursing as your course?
Oh man. So that really does come with a lot of background. So let's see. Where do I start? Why nursing? For me,
Hmm.
unlike conventional traditional way, my parents did
Yeah.
not
Uh,
choose this for me. My
oh,
parents did
okay,
not
okay.
choose this for me. It was of
Let's
my
put
own
that aside.
choice. It was of
Okay,
my own
okay.
choice. So that's and how I made that choice. Well, a lot of factors led up to it. So, I was in the US already when I graduated high school. And then during that time, I was looking at the universities there, very, very expensive. I could
Hmm.
not afford it. And I also did not want to live 30 years of debt, you know.
Yeah.
Um, and so, plus very competitive pool, mainly because they only accept like 30, 40, 50 students. They expect
Oh, every
when they
school.
select all these students, they expect them to graduate. So 50 out of 50, unlike SLU,
You have entrance exam. Yeah.
1,200 went and then filter, 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 you
Hmm.
know.
Yeah.
First year 1,200, second year 800, third year 600, and then fourth year for us 200, right?
Oh, yeah, yeah.
So yeah, for us it was 200 by the end. But my choice was mainly because one, tuition. Tuition fees were too expensive in the US. Plus I was very whitewashed. Until now I still have a little bit of that Americanized, westernized type of thinking. And of course, a lot of us first generation Filipinos, a lot of us
Hmm.
first generation, we have, I've actually spoken to other first generations here in Canada, and a lot of us actually don't have a strong identity as a Filipino.
Oh,
Hmm.
oh, really?
Yeah,
Okay.
they, some of them don't even know the language anymore. And I was there, and I paid attention to Rizal because I remember our teacher in Rizal saying that our language is our identity, you know?
Oh, yeah.
So learning, I wanted
Oh,
to
good for
learn.
you.
I wanted to learn the language
Oh.
again. Even though I'm speaking English now, mainly
Mhm.
because
Oo,
uh
nakakaintindi
I
naman si kuya.
yeah, I'm better
Oo.
doing it in like low pressure conversation, you know? So right now, okay, what's natural to me now is English. So if Filipino comes out, I'll say yeah, okay na yan.
Okay,
But yeah,
so
so that being said, I want to also be more in touch as a Filipino, what it means. And then after that, another reason is I can share this as part of
mhm,
like a little testimony of mine. But I was living a very rebellious phase before being a nurse. I had a very rebellious phase. I was not following societal rules. So bad influence friends, basically. So I knew that my life was not going anywhere positive. And
okay.
so I wanted to change my life. And I had to get out immediately of my surrounding environment. There was too much influence where even if I stayed in America, I wouldn't be able to escape. So that was the third reason. I wanted to break free from that influence. And one
Mhm.
of the best ways of doing that is moving to a
Yes,
completely
moving
other
out.
country, moving out.
Yeah.
So there, yeah, I've always been interested in healthcare. And so I was inspired by the TV show House. I don't know if anyone knows that TV show
Oh, yeah.
House, but it inspired me into being into healthcare. And then, yeah, I was looking for a good job, good career, and just nursing. Actually, nursing was my original job before high school, my original desire before high school. But things changed after high school, and
Mhm.
then with everything happening, I went back to nursing. And so SLU, I told my stepfather, you know, I want to learn, I want to study in the Philippines. I want to study nursing in the Philippines. And then he chose SLU. So he must have researched online. He must have seen that it was a good school, so he researched online. The issue with that is I was trying to enroll while in
Mhm.
America. It was not working out so well. So
You need to come
s-
here.
I went straight there instead. In
Yeah.
August, I went straight there. It was August 2015. I went straight into the administration. I took their entrance exam. I think I
Mhm.
passed.
Yeah.
Yeah, obviously, I passed. I think it's an entrance exam and an IQ test or something like that. And
Yeah,
then, yeah,
that's the way to get in.
the standard, right? Diba? And then
Mm.
I was late for like the first week of classes.
Oh.
Oo.
Taga
Yeah.
saan anong province niyo dito sa Philippines, Kuya
Sa
Rob?
Philippines, sa'min, Pampanga.
Oh,
Yeah.
okey.
Kaya nagtrabaho ako sa TMC.
Oo.
Yeah, yeah, that's why I
Okey.
went there because I just live nearby. Mm.
Okay, so that's why you have chosen nursing, and then you've told na yung paano ka napunta sa ICU. I'll just ask Kuya Rab, what have you seen were the difference or the similarities of working in the ICU in the Philippines and right now there in Canada?
Okay, so I can say that so far I've worked around three ICU jobs now. So
Mhm.
my first one will be 1 year, or should say 11 months and 2 weeks in TMC ICU. It's pretty much a
Mhm.
medical surgical ICU, very generalized ICU. And then care is still basically the same. Airway management, cardiac, circulation, breathing, all that stuff. So they're mostly well, when we came in, it was COVID, so everything was respiratory.
Yeah. Mhm.
Everything was
Oh, okay.
intubation, sedation.
For that whole year, right?
Oh, almost for the whole year. I mean, there would be some rotation. Like for us, we were designated 2 units for COVID ICU, and then the other 4 units were the ones that were COVID negative, but they
Mhm.
were still
Okay.
affected by COVID, and then others were burns. That's really all I can. Oh, burns, and then just complete organ failure. Like,
Mhm.
I don't wanna talk smack. I don't wanna talk bad about anything that
Mm.
happens there, but pretty much like these people go to the casinos nearby, the casinos in
Mm.
Clark. They
Okay,
drink,
okay.
they smoke, they overdo it way too much. They do a lot of vices. They have a lot of vices, and it just destroys their body. And then, yeah, one of them had liver failure, and then they came here, and then they came to our ICU, and then had to be intubated, completely GCS 3, terrible, just
Mhm.
couldn't handle it. But for the most part, the care there, I would say it was pretty standard for ICU, you know. The care is almost all the same all throughout. So
Yeah.
let's
It
just put
just
that one.
depends on the cases.
Oh, it's the
What's are the
cases.
regular cases
Okay,
from the Philippines and right
okay.
there?
Regular cases, usually, oh, I'm trying to remember now. Because it was because in our TMC it was so generalized, I don't really have a specific one. Well, I
Mhm.
remember cardiac surgery, so mitral valve replacements, all that stuff,
Okay.
close monitoring. I remember a really bad burn. That was a lot of COVID, a lot of COVID, and then I believe, um, I remember now, sepsis. Sepsis. So these are
These
our
are adult
these are
sepsis.
older adults. Oh yeah, no
Oh.
kids, no kids. I think there were a few children because there was no other choice. There's no children's
Mhm.
hospital really in Pampanga, but yeah, it was ideally it was mostly adults. Yeah. So ayun. And then for Canada, really the more difference is in Canada is
Mhm.
more independence as a nurse. Like you make more decisions, and we actually end up telling residents what to order. That's the fun part.
Oh.
So you have these
Of
very
course, they're
experienced
residents.
nurses. Oh, they're just residents, right? So
Do they
Uh,
know?
or like we give a very specific thing that we want. So we know what we want. So like, okay, this person is low blood pressure, he's
Uh,
getting tachycardic, very hypotensive. Um, and then also he's spiking a fever and we do some blood work, you know. So we'll just know, okay, let's give him some fluid. Let's just take this lactate level. Let's get some blood cultures. And so we kind of already know what to do. And sometimes if the resident forgets, because they're learners too, right? So we also
yeah,
have a
yeah.
teaching hospital as well. I'm also working in teaching hospitals.
Mhm.
So we also teach them what to do. And
Of course, 'cause,
so,
um, hindi sa pagmamaliit sa mga residents, no, but we start, um, mag-start sa baba, 'di ba? Sa mga residents wala pa silang experience unlike you that you already had the experience, so you can tell them what to do, right?
oh yeah, and it's only the older nurses. It's really the senior nurses that say it.
Yeah,
You know, I know
yeah.
as the beginner, you tend to just follow the order set. But
Mhm,
then as the years go by, as the months go by, the experience, you kind of already expect, and then you start learning the little details that is away from the order set, the little nuances. And so um that's when we end up teaching our residents, of course. But that's what I mean, though, by independence. We don't rely too heavily. We do question their orders sometimes, and
mhm,
sometimes
mhm.
they do make mistakes. So that's why we actually do question, and we don't have we have like this like patient safety type of culture where there shouldn't be any type of bullying, there shouldn't be any type of power
Oh,
differentials
that's
between
that's that's
doctors
the
and
main
nurses.
difference here in the
That is,
Philippines.
I
That
guess
you
so.
have
I don't want
the
to, I know, I don't want to mention it too much, but that is one of the big differences is from housekeeper to physician, we're all the same.
yeah.
Okay. From housekeeper to physician, we're all the same in terms of respect. So we all have our roles to play. We all have our hats to wear. We all have a different
Mhm.
role. So
Yep.
you know, that being said, that's one of the main big differences. And then we're using Epic, the Epic charting. We're not
Uh-huh,
writing.
EMR.
Yeah, the EMR, emergency medical record. We're using that. It really does make things a lot easier and more convenient. It does give a thorough assessment because you're forced to fill out
To
all
yeah,
to
the
fill them
forms.
out. Yeah, because there's a lot of flow sheet here, flow sheet here, flow sheet, all of these flow sheets, and you got to fill them all out as much as you can. Yeah,
Mhm.
and
So
that's
how's
all
the burnout?
done.
How's the burnout
Burnout? Oh,
compared?
I don't know. I don't really feel it because I'm very
Wow!
no.
Coming from
You
the
know,
ICU,
I was actually thinking during COVID, I'm like, all of these nurses are retiring, and then when I was waiting for my RN license to come, I'm like, oh, you know what? I'll work all those shifts for you. If you don't want to work them, I
Oh,
will.
wow.
Because that's what we came here to do, you know. Even though I was born
Yeah.
here, I still feel like I don't know. I don't want to say I don't want to be an imposter and say I'm an OFW because I'm not. I'm really not an OFW. But of course, when you come here and you've worked in Philippines and you see how much we make and you see the cost of living there, especially with everything that's going on there now,
Mhm,
everything's
okay.
a little bit
Yeah.
expensive, right? I can say, oh yeah, it's a big difference. Finally, there are still nurses that are still complaining about their pay, and you know, I'm not complaining, but all
Oh,
better for
okay.
them because they are part of a union. They increase the
Mhm.
pay as the inflation goes up. They advocate for us, and they get our pay
Oh, yeah.
increased. So I'm okay. I'm okay with them. I'm good with
What's
them.
the environment like? Do you have, many internationally educated nurses
Oh
with
yeah,
you?
yes, we do. Yes, yes, yeah. I would say half and half actually.
Okay.
Um, oh, and that's actually the story that I want to share. So internationally
Oh, yeah.
educated
Go.
versus locally educated
Mhm.
or
Go.
domestically educated. So, okay, I can say for sure that I want to give a shout out to all of our Louisian teachers, all of our
Mhm.
CIs, because they give excellent education. SLU, School of Nursing. I only know School of Nursing. I don't know the other half does amazing education. And the reason why I say that is we're worked. We really are pushed to the limit. We're really pushed to our limits. Nowhere else do we have 3,000 hours of clinical
Mhm.
practice. Nowhere else. They'd only finish 1,000 hours for all 4 years. We're having like three. No, wait, no, that's yeah. Is it? Oh, I think we're like 3,000 hours every year,
Yeah, more
actually.
than. Yeah.
Oh, right. Them, I think they're just 3,000 hours for the whole 4 years. So you can imagine.
Oh,
It's
okay.
ridiculous. All of the learning comes after they graduate. They have no practice at all with essential skills, like essential nursing skills, like IV insertion, NG insertion. When we were students, we got to do all that stuff. We got to
Yeah.
insert IV. We get to we get to insert NG tube. We get to flush peg tube. We get to push IV meds with our preceptor. We get to do all these things that Canadian students do not get to do. And when they come out, they're usually a bit more afraid. So when I was precepting
Mhm.
my nursing
Okay.
student, she did not know mitering. That was the funniest thing.
The
Hindi niya
bed.
alam yung mitering sa mga bed corners. That was the most funniest part. I was like, "Can you please show me how you miter your bed?"
Oh,
And
I
she's like,
think I
"What's
forgot
that?"
that now.
Oh, it's our first year, right? 'Di ba? But it was
Yeah,
still an
oo.
essential skill.
Pero
And
alam ko pa rin
they
yung triangle stuff,
Oo, yung
then you do
triangle, 'di
this.
ba?
Yeah,
Pero siya
oo.
hindi niya alam talaga yung mitering,
Mhm.
like, it was insane for me because I thought this was basic, right? But and so I had to teach her. I had to teach her that. I had to a lot of students are afraid to do something, but I'm allowing them to do it. And I don't mind putting my license out there because it's really for their learning. Of course, I'm supervising and of course I'm making sure they do it right, but I want to bring the experience I had as a student to them. And
Mhm, mhm.
ayun, like, um, we're able to do so much more, including if I know some of our batch was lucky enough to deliver a baby. I was one of them. I was lucky enough to deliver a baby and
When you were a student?
in delivery, yeah.
Oh, wow!
Yeah,
I want
it
to
was
hear about that.
my goodness. I was with I'll give another shout out to Ma'am Makara Egg because I was with her.
Oh, makareg,
And
yeah.
I was with her, yeah, it was great, it was amazing because I was with her, there was nobody in the labor room, no one at all, um,
Oh, it's
and
in the
it's in
hospital
the hospital, the
area.
labor room, in BGH, and
Okay.
we were what do you call this? Oh, yeah, it was just me, her, and the patient, and this patient is G6, P6, so
Oh,
she's very dilated, and
okay.
everything's coming
Yeah.
quickly. There was no one else. One push, head is out. Like, oh my gosh. That was a lot. Everything is done. Everything is done. Like all you have to do is grab it. Like that's the hardest part, and
Uh-huh.
she just did one push. So
So how was it? How was the
it was
experience?
it was a bit nervousing, but I had a great teacher to guide me. So she gave
Mhm.
me the blanket. She told me, it's okay. Remember the training. And then I grabbed she was actually there to hold the blanket under my hands
Yeah.
just in case.
Uh-huh.
I was very, very happy about that. So the baby came out. There was one cord loop. I remember the training. You stick your finger underneath,
Finger. Yeah.
loosen the cord loop, bring it to the mother, and then yeah, the doctors came in, the nurses come in, and then it's already done. And that's
Oh.
it. And that was an experience. And then I know some other batchmates also that got to experience that too. So it was not just me, but it was really cool. Very,
Oh,
very cool.
I remember. I think I have one incident, but that's not my group.
Oh, not
Na
your
ganun
group.
din.
Mm.
And same hospital.
No.
So yeah, ganun.
Very, very
Um,
amazing.
I'm wondering where you get that enthusiasm, especially when teaching. Did you have a good experience back in TMC when they were teaching you?
Oh gosh, no. It was a terrible experience because this is actually ties in to my, I may as well because I know that our viewers are Christian, so I'm okay to share my
Okay.
story,
Go.
which is
Go.
nice actually. Being in the Philippines is what actually brought me back to Christianity because when I was in the rebellious phase, very agnostic, very atheist,
Okay.
but
Okay. wait, for the viewers to capture what you're saying. So my first impression of Kuya Rob was our, diba, sir, in our tennis, in our intramurals, Kuya Rob was wearing, of course, his clothes, but nakita ko yung ano, yung mga tattoos on your body.
Mm-hmm.
So, and then I think our coach said na, you're from abroad. So, syempre sa mga Pilipino kasi medyo ano pa sila, eh, medyo ano 'yun, ah, pangit yung
Conservative.
tingin sa ano,
I know. I'll
conservative,
use the word
that's the right
conservative.
word.
Yes, that's the
Yeah,
right. And I'm
yeah.
okay with that. You know, I definitely understood that. I actually made sure I was not too showy. I even
Mhm.
requested the length, the arm length of the uniform
Yeah,
to be a
kasi
little
you
lower.
can
I
see
remember
it,
the pink book. I remember almost every little
the
rule in
rules.
there. I
Mhm.
remember every little rule. Oh my goodness. Oh yeah, it was really fun reading that. So I just tried other ways to hide it, you know. So yes, yeah, that was that kind of phase. So yes, going back to that preceptorship, pretty much we're having a code blue. We're doing full CPR. We're
That's in the
doing
Philippines, right, sir?
in the
Ah,
Philippines ICU.
oh, yeah,
Yeah, Philippines
okay,
ICU. We're having a code, and the patient expires. The patient dies.
okay.
Um, Now, at the time, I did not understand what it meant to be cost efficient, to be like have safe handling. The Foley that the patient had
Cost
was,
efficient.
yeah.
Oh my
So
gosh. Okay,
I'll
okay,
tell you what I mean
okay,
because it's a
okay,
really
okay.
scary story. It was not really scary, but it was a life-changing story for me. For me, it was a life-changing story. So the patient had a Foley, indwelling Foley catheter that
Mhm,
was for needle aspiration. So the balloon was used, it was not a needleless balloon, it was a needled balloon because it was an old school, it was
mhm,
very
okay.
traditional
Yeah,
Foley. And during the code, they are aspirating epinephrine for their every 2 minute ACLS
mhm, yeah,
protocol. They give epinephrine, and then they're putting the needle into a sharps, but it's not an enclosed sharps. It's just a kidney basin. So
okay.
me, I should have known better to just grab a whole new syringe. But for some reason, I was thinking, you know what? Maybe I can save this person money because it's always all of it goes on their bill. I grab it, I put it onto a new syringe. It's a new syringe, but the needle was used for the code. I don't know if it touched blood or not. I just don't know. I do not yet know. Then I uh I go through the Foley catheter and it goes through the Foley catheter and I get a finger prick. So that's my first knee stick injury. And
God.
what made it scarier is the patient was HIV positive.
Oh my gosh.
And not only HIV positive, untreated HIV. So he had a high viral load.
Load,
According
yeah.
to the infection doctor, the infectious doctor, high viral load. And I'm like, oh my Lord. I didn't even know Lord back then, but like I went to the chapel every day, every shift. I went to the chapel and I prayed and I made a deal. I bargained with God, saying if I'm negative in 6 months, I will come back to you. So
Alright, okay.
because
Good for you, Kuya
the
Rob.
result does not come back, until 6 months. So I worked
Yeah.
for, and this was the very beginning, my first 2 weeks of working.
Yeah,
This is my
you're
first
a
two
new
weeks of
nurse,
working.
right? Mhm.
And that goes to show the preceptorship level, you know, like I had a great, I mean, I love that preceptor. It's just like, it was just that one level of something got missed. It was really my fault though. I was dumb enough to pick a used needle, right? So, but I made a deal. I was at 6 months. If I'm negative, I'll come back. I was negative. I came back. I came back, and then from then on,
Okay, okay.
like I just started to be more of a. I started to believe more. So it was a beautiful. Yes.
Oh, so I think that's your most memorable experience from your ICU.
There, yeah, yeah, yeah. Yeah, there
Do you
was a
have more?
whole
Do you have more?
SIR. There was a whole incident report about it. Very, very big incident report. You
Uh-huh.
know, ever since that time, I never became cost efficient with anything. I just throw away whatever it is.
Yeah,
If I don't
that's
need it, I
much
throw it out.
safer.
Much safer. Even if it costs, well, I'm lucky to say that in Canada, we have the universal healthcare. So I don't
Oh
really
yeah.
waste a lot of the
Mm-hmm.
material, but I'm not afraid to throw something out.
Okay,
Yeah.
okay.
Yeah.
Oo, tama, tama. So, oh, sa Canada, Australia, I think all the British colonies have that,
Oh, you
yung
want a
universal
universal?
health.
Oo.
Mhm.
Yeah.
Okay. Ako din naman na needle prick pero luckily naman hindi naman siya ano, HIV positive or what. But
Mine was, yeah,
it's
mine was
it's
really scary.
it's so the those who test us parang nagalit kasi sa'kin, eh. Bakit kayong mga nurses pa hindi kayo nag-iingat? Eh, accidents happen, 'di ba?
Mhm.
So gano'n, that's really a, um, accidents happen kasi kahit lagi kang maingat, kahit ikaw yung pinakamagaling na tao, 'di ba?
Mm.
So
Yeah,
wala,
exactly.
but
Oh, people make mistakes. They really do.
mhm. So
They
it's,
really, really do. Kaya doesn't matter if you're
bangon
cum laude
bangon ka,
or no.
'pag
Yeah.
nagkamila ka, oh, 'di ba? 'Pag nagkamali ka,
Mm.
bangon lang. Alright,
Oh.
okay.
I
So,
do, I would,
we
yeah, oo.
may isang commenter tayo ulit, isang CI natin, Sir Piduka. Kapitbahay ko siya
Ay.
dito, si Sir Michael. He says, "Hi, Rob."
Hi, sir. Good to see you. Good to hear from you.
Alright. Okay, so any funny moments mo naman sana sa ICU?
Funny moments.
Meron ba? Meron ba o very serious lagi sa ICU?
Mm, let's see. Do I have any funny moments? Really? No, because a lot of it is
The
end
environment,
stage. A lot of it is end
yeah,
stage, and a lot of it is very
it's the
grim,
environment.
very grim, very, you know, the only one that's really positive is the one I'm in now.
Mhm.
So the ICU that I'm in now is cardiac surgery. These are the ones with the fresh hearts, not heart transplant, cabbage, coronary artery bypass
Oo.
graft, aortic valve repair, mitral valve
Mhm.
repair.
So you
Mm,
enjoy that now?
oh, I love it. Yeah, that's my new ICU job right now, and very, very cool with using the Swan-Ganz catheter,
Oh, yeah,
measuring
yeah.
cardiac output, measuring cardiac indices. I just started. But, in a few years, I'll be able to learn, ECMO
Mhm.
and, intra-aortic, balloon pumping. So I'm really excited to learn all that stuff, you know? So, it's that I would say I would say, though, the in my med surg ICU, back in my other job, um more sad because it was med surg. So there we get a lot more GI
Mixed.
bleeds.
Mhm.
Yeah, GI bleeds.
Yeah, that was very common back then when I was
Oo,
working, the GI bleeds.
electrolyte imbalance. A lot of our
Mhm.
patients there were nephrology patients,
Oo,
dialysis
oo, oo nga.
patients, hyperkalemic, and of course heart rhythm changes. So they come down to our ICU. And yeah, it's with end stage renal, it's very, very uh it's just like a waiting game, really. Yeah,
Oo.
yeah. They're
Unless
trying to
maka-receive ng bagong ano,
oh,
bagong
but
kidney mo.
that is the core though. That is the very medical surgical you can get. And that is like all the complications of a nephrology patient is all
Mhm.
of the complications you could ever think of. You have with renal failure, you can get cardiac failure, heart failure, you can get third spacing into the lungs, and then all of a sudden you have a respiratory issue. You also have electrolyte imbalance, fluid imbalance. Everybody's very puffy, very edematous, general
Mhm.
everywhere,
Tama.
everywhere, everywhere. And then they don't pee. They just don't pee. And
Mhm.
then a lot of them have poor immune system. and then they end up having Clostridium difficile. They end up having hospital-acquired
Infections.
pneumonia, MRSA, VRE, all of the stuff. And you apply all of your techniques, everything you almost learned in nursing, you apply to those patients. They'll have everything. They'll have almost every
Mhm.
tube. Yeah, it's it's called it's they're known as the heaviest patients in the hospital. But I never found that as a deterrent. I was more drawn to it because that's where you're going to learn the most. Usually the
Oh,
hardest patients, the heaviest patients is where you will learn the best.
CKD patients.
No,
I
you'll
think
really learn a
they're
lot.
very resilient, those CKD patients on dialysis. I think they're very resilient people.
Oh yeah. Yung mga outpatient, they do great. I love the
Oo.
outpatient dialysis. They do really, really well. As soon as they start becoming non-compliant, they get a lot of bed sores. Not even from the hospital, but because they're so immobile, they stay at home. They're immobile. They end up getting a pressure sore. Sometimes they come in with stage 2, stage 3 already,
Oh,
and then oh, on top of that, right? I was watching the previous episode.
yeah.
Uh,
With
Na
Kuya
Kuya Nasser,
Nasser.
yeah, Nasser, Sir
Mhm.
Nasser was mentioning diabetes and hypertension. Very, very true. You get people in DKA, you get people with venous ulcer disease, you get people with very, very poorly controlled sugars. I've seen my patients in the nephrology unit with
Mhm.
diabetes and hypertension. We have a joke. Our long and our That's the funny actually part. Our funny joke is our patients have only one or two legs, just one leg actually.
Mhm.
Most of our patients have three extremities. Some even only have one extremity. In fact, this one patient always cracks me up as a nurse to a patient because this patient is bilateral, aka bilateral
Mhm.
above the knee amputation.
Above the knee amputation, yeah.
She's already left-sided stroke, so her arm does not
Oh,
move very well.
move. Oh.
And she's also diabetic, a kidney patient, dialysis, and
Mhm.
like hypertensive. And on top of all of it, she only has one right arm that works,
Mhm. That
and
works,
she
yeah.
still smokes. She still goes out in her wheelchair to have a cigarette, to drink alcohol, to do drugs.
Is she a
May
nurse?
It's the patient. It's the patient.
Is she a nurse?
Oh,
'Di ba lahat ma usually kasi din mga nurses din is, matitigas ang ulo, 'di ba?
oh, yeah. Oh my gosh. No, I never really saw it that like that.
So, alright, Kuya Rob, marami kasing nai-intimidate sa mga ICU nurses kasi siyempre sa mga equipments na dala ninyo or alam niyong gamitin. So, what type of personality or yung person do you think is, compatible with ICU nursing?
Okay.
And, kailan ba super galing ng magiging ICU nurse?
Okay, I have a good answer for that one.
Okay,
First of all, no, we don't need to be super good. We don't have to be super namamagaling to be an ICU nurse. I want to put it out there.
okay.
We have a lot of new grads that are just average learners. They're not exceptional, but they take the time and they ask lots of questions. They
Right.
know that they're vulnerable. They know that they're weak nurses, and they're humble about it, and they work with you. They never do anything alone because to us, we're more than happy to help another nurse learn ICU skills. Our only concern is patient safety. I don't want to leave you alone and find my patient coding. I don't
Mhm,
want to do
oo.
that. I want to make
Definitely.
sure you're coming to me when there's an emergency. And that's what a lot of us expect. So we have international nurses that haven't worked in 5 years. We have new
Hmm,
graduates. A lot of them don't even graduate as like high honors or cum laude or anything
oo.
like that. What really matters is your humility, your Makikisama. Makikisama is so very important. Your ability to get along, because in the
Uh-huh.
ICU, we all work as a team. When one patient is going through a bad time, we're all there to help out. That is our thing. Actually, I have a funny story about that. In my
Okay.
first year as ICU,
Mhm.
pasaway pa rin ako. I did not have makikisama. I did not
Oh.
have, wala akong kusa, wala akong makikisama. I was a very selfish nurse, very selfish, immature nurse. And it took a lot of um, side meetings with me to understand that, oh, you know what? Just because they don't ask for help does not mean you should not go out there and help. So what I
Oh,
really
they pulled
love.
you aside to tell you
Oh, they
that?
pulled me aside. They scolded
Oh
me.
my gosh.
They oh, they scolded me. The charge nurse, the intensivist, they scolded
Uh-huh.
me. They scolded me for
Okay,
being very
okay.
selfish. And I understand. I really get it. I
Mhm.
really understand now. So I learned it took me a while too, because I was just being too westernized and thinking, if they want help, they can
Mhm,
ask
mhm.
me. But no, it's
They can
not
just
like
ask.
that. Even here, just initiate, initiate, lend a hand.
Oh.
Because,
Mhm.
and that's what I learned the best about Philippine nursing is that, of course, you have makikisama, you have that, meron kayong kusa, like you have that understanding to help someone without saying anything. That really is another thing about the heart of a Filipino as well. So
Mhm.
that's another thing that a lot of Westerners do not understand either. So when you carry that with you here, it really works out. People like you a lot more. You have a good rapport with your teammates, and then you do your work. You do your work. So, ayun.
Okay.
Do you have to be super good? No, you don't. And then the other question was again, yung first part?
Um, do you recommend sa mga new
Yung personality type. Yes. Okay. So
your
yeah,
personality type?
almost everything that almost every ICU nurse has in common that I've noticed is they're all organized. Very, like, that's
Mm.
type A personality, very detailed to the core. They just want everything nice online, a little bit ok, a little bit OCD type.
Okay. Mhm.
They want to make sure everything is all lined up. They want to make sure everything is clean. They want to make sure all the linens are wrinkle free. Like me, I
Oo.
want all my
Oo.
linens wrinkle free. I want them all
Oh,
nice and tucked.
talaga?
Yes,
Oo.
another shout out to Ma'am Baila for teaching that that stuff
Mambayla.
matters. That stuff matters. They in Canada, they don't really like Nightingale because of some racism, but she had a good environmental theory, and I still carry that environmental theory. So making the room, how the patient looks and how the room looks tells more about you as a nurse, and that stuck with me. That is one of her teachings that really stuck with me. So,
Yeah.
so, ayun, like I always wanted to bring wrinkle-free sheets. I want all of my tubes lined up. I want all of
Mhm.
my everything where I can see it. My room's got to be nice and tidy. Um, the patient's got to look good too, nice and clean. Like no, you don't want any crust here, dry lips, nothing like that. Um, and so a lot of our ICU nurses are also very similar. They want to make sure everything is in order.
Organized. All right.
Yes,
So
organized.
with that, Kuya Rab. Okay. So I'm from the ER, right? Dun
Oh,
yung usual na ay yung dun yung
very opposite.
experience ko.
Yeah.
Do you really have the ER and the ICU people really have the beef? Oh, may
Oh, yeah, they
pagtatalo ba
do.
talaga?
Oh, nag-aaway talaga sila. Because we hate receiving admission from them. We hate it. We'd rather
From
have
the
a
ER?
direct, from the ER. We'd rather have a inpatient transfer or a direct to ward instead of
Uh-huh.
ER. And the reason why is because everything is so magulo. Ang gulo talaga yung mga ER nurses. Like, they hook anything and anywhere. They don't have all of their pumps lined up. They don't have anything running independently. They don't follow the IV. They don't follow the monograph. Di ba meron tayong policy about
Oo, yeah.
where to insert the drugs? what can be mixed, what cannot be
Uh-huh.
mixed.
Yeah, yeah.
They don't care. Their emergency is bed flow. That is their job, bed flow. That's how I see it. Their
Oo,
job is
ipasa
bed
mo na
flow.
lang diyan.
Oh, and their assessment, there's nothing there. We don't know what anything is like other than their little note. But they don't fill out the charting. Everything is completely blank when they get us. They just give us a very small story, and then that's it. And then we're left to figure it out. We have to undo everything that they've
Everything.
done. Oh, same, yeah, same, yeah, I understand. ER, also very chaotic. Um, but yeah, very magulo. Similar critical care. One is order,
Oo,
one is controlled, one is uncontrolled.
controlled
Oh,
chaos.
controlled chaos. Yes.
Have you had the, opportunity na mag-float dun sa ER
Oh
or
yeah,
no?
I did. I
You
did.
had
I was spoiled.
how was the experience?
It wasn't
Ah,
too
you were
hard.
spoiled?
I was spoiled because I only floated once, and I wasn't even in the critical care area. I was in the
Oh, okay.
in our little town in actually in Canada. Um, drugs are a huge problem. So
Mhm, yeah.
overdoses are a huge problem. Substance abuse is a huge problem here.
Oh, so dun ka ano
And
pinunta?
oh, like we just deal with the ones that are, they just need a little bit of time
Mhm,
because they
yeah.
want to avoid admission. Yeah. But
Okay.
honestly, I did not like it because somebody came in with a 25-year-old came in with a blood sugar of 22
Oh,
millimoles. I don't know what that is
oh,
actually. I think I have to convert that. If we just convert that
in,
really quick. Oh,
that's
22.
so high.
It's high, 'di ba? 22 because
Mhm,
we use
mataas
millimole
yan.
for Canada. I know
Milligram per deciliter
USA.
in the
Oh,
Philippines.
CBG. I'm gonna just convert that right now because for our viewers.
I think that won't even show in the milligram per deciliter
I
glucometers. It only says
Yeah,
high, I think.
it only says, well, actually, our limit is 27. So let's see. I'm just gonna find out really quick. CB blood sugar. Okay, we're gonna find out very quickly just now. It is 396. Very high.
No, okay.
396 milligrams. And you know what? I was like, why are we not gonna get this person some insulin? Should we not give him some insulin right now? And then the ER nurse was like, no, he's fine. He's fine. The doctor will see him soon. I'm like, are you kidding me? This person has a sugar of
But
22.
you have the protocol, right?
We can't, no, it's the
Well,
ER. So we have to wait. We have to wait. And then
oh,
because I'm a
okay.
floater there.
Okay.
I'm a floater. I'm not a staff
Ah,
there.
hayaan mo na sila ganun.
I'm just going to follow
Oo.
what they do. I'm like,
Okay, okay.
okay, okay. I mean, I'm keeping my eye on him.
Mhm,
He's
mhm.
still fine. He's not going into DKA or anything like that. But I'm like, oh my gosh, like this is what ER does around here. Because
Alright.
in the
We're
ICU, at 22, we treat it right away. That's it.
ah, okay. So we're crossing now the 1 hour mark. Gusto
Oh
ko
my
lang
gosh.
i i-confirm yung myth na ito or i-disprove. Totoo ba na 'pag kumain ng pansit is, magiging toxic ang duty mo? Diyan
Yes.
sa Canada,
Uh,
yeah?
I here in Canada, I know in the Philippines, yes, it's true. It definitely works there. I don't know why, but every time somebody brings it in, it's just a very toxic day. Somebody codes, somebody's crashing. It's just not a good thing to bring pancit. Here, actually I noticed because we have a few Filipino nurses
Uh-huh.
in our floor.
And they bring pancit?
They bring pancit and it turns out to be a busy day. So, maybe it does
So,
carry.
yeah.
I don't know if the phenomena happens over there too. Full moon? You heard of full moon effect?
Oh, yeah, okay,
You
okay.
know the
Yeah,
full
I've
moon
heard it.
effect? It's okay for our. It's very sensitive to our nephrology patients,
Mhm.
mainly because they're already so fluid imbalanced anyways, and
Yeah.
they're very delicate in their electrolytes. So whenever there's a full moon, all the uric acid goes into their head. They're very uremic in their mind, and they become very behavioral. They'll start calling the bell
Oo.
like 5 times in 5 minutes. They'll start complaining for things that they don't need. They want to get up. They're confused. They're delirious. Everything goes crazy. And so that's
Alright.
that's for our
It's
full
the
moon
full moon
effect
effect.
here.
I
Oh,
think
I
in
don't
the
know.
ER, 'pag full moon, alam mo na yung full moon na maraming mahuhulog, somebody will
Yeah.
fall.
Oh, yeah. That's the
Oo,
one.
oo, 'di ba? Alright,
Yeah.
okay. So, before we continue, I would like to shout out Ma'am Jen Antonio. Sabi
Hi,
niya,
Ma'am
"Greetings to
Jen.
both Tatak Luisian." Alright. Tatak. Okay. So, before we close it, I just have one question, and then, uh, we'll end this one. Okay, so Kuya Rob, so na-start mo na 'to, I think, before we started. So, is it hard or what's the process for a PHRN to be a Canadian RN? Parang
Okay.
short lang na ano,
Yes.
oo.
Yes. Yes. All right. So yeah, I know we talked about it earlier, but
Mhm,
basically the step by step for majority. I'm not going to use mine experience because
mhm,
it's just I'm very blessed to just have been born here. Okay.
mhm.
So for the majority, they're Canadian, they're a Filipino citizen with a PHRN license. Um, what usually happens is they usually know somebody in Canada, whether it's an auntie, uncle, family member,
Mhm.
and then that is their place of residence. That's where they'll stay. That is where they will try to stay. It
Okay.
doesn't have anything yet to do with the process, but that is where they'll stay. And then because they're their relatives, they do help out. They do help out with a little bit of with the pay. The one of the fastest ways to do it is to and from what my colleagues have told me, they would apply as a student, international student,
Student visa. Oh, okay, okay.
student visa, get student permit.
Mhm.
They travel to Canada. They stay at their place of residence. They go to school, and while they're going to school, they
School
are
for nursing
anything,
specifically?
anything.
Anything?
No, anything. It just has to be something. Usually,
Okay.
health administration, some post grad certification course that lasts one to
Mhm.
2 years.
Okay,
Because
1 to
then
2 years.
that gives them another time. That gives them enough time for their next plan. So they do that course. They apply for their PR, their permanent residency.
Permanent
Green card is
residence.
the equivalent. Um, then they will. What else will they do? They're waiting now. So now they've applied. They're waiting. They finish their course, their studies. They finish their course. Their student permit will expire soon. They apply for work permit.
Mhm.
Then they apply for work permit. It buys them more time for the PR. They get hired by a company, usually from nursing. For us, it would be
Uh-huh,
nursing.
okay.
So, and then
So
here's the thing.
not usually RN? Not
Not
usually
yet,
RN?
not yet RN.
Okay,
No, they're actually working as PS. We have what we call them here is personal support worker. It's
okay.
equivalent to healthcare aide in the Philippines, equivalent
Uh-huh.
to nursing aide in
Sa
the
Philippines. Oo.
in America. Yeah.
Oo.
Yeah. So, ayun. So you have your PSW. They work as that. That's going to be their work while they're waiting for their status. And in fact,
Oo.
while they are actually, now that they have their work permit, they can actually start applying for the other stuff. So this is the hard part. Ma'am Jen knows this very, very well
Mhm,
because a lot of us have gone through her to apply that stuff. So what's best is you do it all before you leave. You do it all while you're in the Philippines.
mhm.
The worst thing to do is have an authorization for somebody. You don't want someone going back and forth with your
Oo.
papers to
Mahirap 'yun lalo
PRC,
'pag
to SLU. Oh,
oo, lalo 'pag
lalo na,
hindi niya alam sa SLU or sa PRC, 'di ba? Or hindi siya
lalo
nursing
na yan.
related, gano'n, oo.
Yeah, exactly. And so, and you're carrying a lot of papers, a lot of special documents.
Tama.
Um, So that being said, before you even leave, you go to school, you go to SLU, you do the National Nursing Assessment Survey. That would be the international accreditation for
Mhm.
Canada from abroad schools. So
Okay, okay.
Philippines is one of them. I'm happy to say that I'm very proud to say that SLU has equivalent nursing standard, education standard as Canada. So we don't have to do extra schooling. That
Mhm.
is that is great. No extra
Okay,
schooling
oo.
for Louisians.
Maganda 'yan.
Oh, no extra schooling for Louisians. Next is your PRC. Next is your PRC.
State board.
You need to transfer your board license to the provincial regulatory body. For Canada, for me in Ontario, it's College of Nurses of Ontario.
Mhm,
That
okay.
is for me and for our other colleagues that work in Toronto. So that's where the PRC will send it to them. Actually, they also send it to the NNAS too, the International Accreditation, because
Oo.
actually everything gets sent there first, and then the accreditation sends it to the school, to the to our provincial board. Pala, sorry. And then, okay, PRC is done. Next is
Mhm.
work of employment. So ideally, you do want to have some work experience before you leave, because they will
Oh,
be
okay.
looking for work experience for the past 3 years.
Mm, mhm.
So
For the past
ideally,
3 years.
ideally you want to be working. Um, so for me, my last job worked was SLU. It was SLU
Oo.
as a CI. They counted that as my last work experience. Thank God. So there, it was able to, when you bring over all of the requirements, then they see, okay, you have your work experience, you have your PRC, you have your schooling. Then you then you have submit the survey. You submit it's like this thick of pages. It's
Mhm.
like really, 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 really heavy amount of pages, especially from SLU. It's everything you've ever done. It's really this much, really a lot. Then you would they send it to the survey. The survey says, okay, it's applicable, it's accredited, no extra schooling. That's the best part.
Mhm.
No extra schooling. That is the big news. Then you choose where you want to send it. You can send it to Alberta, to Manitoba, to Saskatchewan, British Columbia, Ontario. I have a friend in I think Manitoba, Winnipeg.
Mhm.
He sent it there. And then yeah, mine Ontario. So you send it there, and then they ask for your last schooling, your last work, your hours, all of that. Everything will pass. Then you're opted to take the NCLEX. So here's a trick of what a lot of international nurses do. This might be
Mhm.
helpful for the future nurses that want to come. Take your NCLEX before you come to Canada.
Oh, okay.
That way, you don't have one reason is because it bypasses the education part.
Oo.
It bypasses the nursing education part. So if for some reason SCU was not comparable or partially comparable, your NCLEX will bypass that and you still don't have to do extra schooling.
Mhm. Okay,
Now,
okay.
to bypass the NCLEX somewhere else, they usually somehow sign up for a state, whether it's New York. For me, I chose
Oo.
Guam as mine.
Mhm.
A lot of people go to New York, or New Mexico.
That's the easiest, I think.
Some easy entry state for NCLEX because once you have the NCLEX, it can be endorsed anywhere you want.
Oh, okay.
Anywhere you want.
Okay, okay.
Yeah. So just take it as fast as you can. Make it the first priority. You don't even have to submit your survey first. You can just take the NCLEX first, and it'll be good for 5 years, or even less than, or even more than that.
Oo.
Um, then you have your NCLEX, you have your schooling is done, your status. That's the only thing. So if you have a work permit, you can start working as a nurse. But if you're an international student, you cannot. So get your work permit, you can start working as an RN. The processing time, with my circumstance, 8 months. With majority, 2 plus years. Long
Okay.
time. 2 plus years for
Mahaba-haba din.
majority.
Mahaba-haba
Oh,
'no? Oo.
mahaba. Mahaba. Yep. So once all that's all set, um, you get a notification that it's done, and then That's
Then you
it.
have a green
Nurse ka
card.
na. You
Oh.
start working, and then whatever experience you have, you can use your NNAS copy, your because they'll give you a copy of the report.
Mm-hmm.
You can use that copy as evidence for hours, for employee hours, clinical hours, and use that for your pay grade. So,
Oh,
okay,
para tumaas yung sahod mo. Oo.
I have 2 years of experience. It'll carry over. So here
Oo
in
nga, oo.
Canada, instead of getting paid 39, you get paid 41, something like that.
Mm.
Mm,
Oh,
yeah.
it helps, it helps.
Yeah.
Okay. So, yun.
Ayun, I'm sorry for everybody if
Hindi. Alam nila yan, ma nurse naman sila, eh, 'di ba? Tapos sa Canada ka papunta, 'di
Oh
ba?
yeah.
Eh,
Oh yeah.
kailangang,
Sabagay. You really do lose it. For me at least, because that's not my first language. So it's okay.
oo.
If
Pero
I don't
pero
practice,
naiintindihan mo
wala
naman,
na.
eh. That's good.
At least that's the important part. Kaya ganun, like
Oo, 'di ba? Hindi ka
that's what
mabebenta sa Pilipinas.
oh, I'm telling you, before nursing, I had no language of Filipino. Wala talaga.
Oo,
Didn't
oo.
understand. I was always lost, very confused. I would have been sold. Yeah.
Oo, 'di ba?
So, ngayon hindi na.
So,
It's okay.
alright. So, before we end, anything you want to add or greet, Kuya Rab?
Oh, well, of course, I just want to give a big thank you to my alumni, SLU, School of Nursing. Um, I do, if in God's will, I do pray one day that I will be a nurse, a CI there as like a retirement job. Like I want
Oh,
to get a
wow.
lot of experience
Okay.
here. I want to get a
Okay.
lot of experience abroad, have a lot of stories, and then when I go back there, I'm just going to share stories and teach. And
Oo nga,
then,
eh.
I hope,
Wow.
hopefully they'll take me back. So, you know,
Paano kaya ako,
uh,
'no? Parang puwede yan, ah.
yeah. And in fact, if they even offered me to do online, oh sure, I'll help. I'll teach
Oh, yeah?
online.
They're watching. I
I
know
know,
they
right?
are.
Yeah. And then, yeah, really, Louisian education, nursing education is top notch. When they say prestigious school, you really don't see it until you're outside and you really see how different it is. So, big congratulations, big pat on the back for everybody, for all the CIs there that create amazing global nurses. It's just incredible. And we're spread all over the world.
Oo,
All over the
oo.
world. Yeah, not just Canada, UK, US, East and West side. Some are in I think I've seen some
Australia.
working in Australia, yeah. Yeah.
Mm.
So it's Germany. I know a batchmate in Germany.
Oo.
So yeah, it is that is all. Thank you. Big thank you to all of you there. And then yeah, and then to you, Franz, yeah, congratulations on getting to US. And I hope that you'll be able to get your status soon. You'll get your
Oo
papers
nga,
soon,
oo nga. I
you
hope
know.
to. Thank you, Kuya
And
Rab.
you'll like working as an RN there. You really will. The money is amazing. In fact, I still have plans of going to California. So maybe one day I can work with you.
Oo nga.
So
I can visit your,
yeah.
beach resort or house.
Ah, oh, so broke right now. That's the funny thing. They say that you'll get a good future. I don't know. I have to work overtime.
Oo, lalo na may pamilya ka na, 'di ba?
Oh yeah,
Oo,
exactly.
yun yung hirap, diretso yung work mo, eh, kasi yung
Mm,
bills mo,
mm, mhm,
oo.
mhm. Oh
Ah,
yeah.
with that, Kuya Rob, meron pa ba?
I don't know. I can't think of any at the moment. I could go on and on about my work
Alright.
though, but I have a lot more stories, but
Or we'll
you
have,
know.
part 2, 'di ba?
Oh my gosh.
'Di
All
ba?
right, maybe when I have more stories.
Oo, 'di ba? Thank you, Kuya Rob, for,
Okay, thank you,
giving this,
Franz.
opportunity for makausap ka, makakuwentuhan and, mga updates din.
Oh yeah.
And Yun, I know that, life's, um, yung natutunan ko is, how to appreciate nursing more with your stories.
Oh, yeah. I mean, I think, I want to say to our students to really take it slowly.
Oo.
For me, university was really the best times of my one of the best times of my life. That's take it slowly, you know. Um, Study hard, but also don't forget your comrades. They will
Mhm.
take you far. They really will, and you'll have friendships that last for decades. That will last a very
Oo,
long
tama.
time. So build your relationships while you're still there. They're going to be your best friends, and then do it together. You'll share story. That's what I feel like, like we all go to different careers, but we share our nursing stories. We
Oo, 'di
really
ba? Oo,
do. Like
tama.
I have a friend that's in medicine now, and he's just done, and I'm sharing my stories. He's sharing his stories, and it's funny. They're all really funny stories. We love comparing the work. It's really, really funny. And that's what
Oo,
keeps us motivated. Like, oh, you know what? We're doing this for a reason. And the best part is really the care when you actually, make a difference.
oo.
You in school, it's hard to appreciate, but once you really get to the care itself, that's when you'll feel like, oh, you know what? I'm valuable to this person. This is the
Oo,
only
'di
care
ba?
that they're gonna get.
Tama.
Um, because the in Canada, it's not the family doesn't take care. I know in
Oo.
Philippines we have lots of
Walang
watcher,
walang
yung mga
watcher, oo.
watcher, mga family member. They're doing the cleaning too. Here, they visit. They visit. We do try to implement a lot of transcultural nursing. I know that's been an issue in the West where transcultural nursing is an issue. But lately, because of the DEI, the diversity,
Oo.
inclusion,
Diversity,
exclusion, inclusivity,
tama.
whatever, there's been a lot more change with visiting policy and
Mhm.
culture awareness and all that kind of stuff.
Okey.
So the best part is the care. The money does come. The money does come later. It'll help you, but it's really not the most important thing. It'll definitely help though, and you'll enjoy it. So for me, I've enjoyed. I love the adrenaline rush of the ICU. So somebody is having a hard time. I like feeling like, oh crap, we have to do something very very quickly, like right now.
Oo, oo.
So a lot of it is your preference. If you just want to take it slow, you can go to rehab. If you just want to if you just want to but it's also if it's also your interest too. If you want to be an operating room nurse, go ahead. Please be,
Oo,
yeah. If you want to work in dialysis, all the better, you know?
oo.
So plus a lot of people pick different careers for different reasons. A lot of it could be
Tama,
scheduling,
tama. Yun
life
nga ang
work-life
maganda
balance.
sa
Oo.
nursing, 'di ba, maraming maraming pathways tayo na
Daming
puwedeng
pathway,
pasukin.
marami.
Oo,
Like you can have it any way you want in nursing, especially on this side. Like, you want to take care of your kids and do nursing, you could be a manager or an educator.
oo, tama, oo.
You want to learn more, you go for ICU, you go for ward, you go for, specialized area. You want to learn something specific, specialized area. So, as a nurse, there's so many pathways you can take that, like for me, I do home health too. I'm also in public health. I'm in community health as well. I go to the patient's house.
Okey.
Yeah, I do that as a
Hustler ka pala,
casual
eh, hustler ka pala,
side
eh.
hustle, right? There's a lot of
Oo,
opportunity. I do it as a side hustle. I only work maybe 2 hours every other day. I go there. I do wound care. That's it. Wound
mhm,
care for venous ulcers, of course. It's a pretty complex
oo.
wound, but there's also satisfaction in seeing it grow. I mean, seeing it heal. Sorry,
Heal,
seeing it
oo,
heal. There's satisfaction in knowing what to do if there's a complication, you know, if you need to send somebody to the hospital. I've also done long-term care. I
Oo.
was also casual job for
Ay,
long-term
oo?
care, geriatrics. Yeah, it's fun. Like, okay, I mean, not to boast, not to brag, but
Oo, oo.
I think at the in the turn of the clinical graduation, I got awarded for best in adult health. I think I took it too
Oh,
seriously.
wow!
I
Sa
took it too
clinical
seriously.
graduation.
I took it way too seriously, and I just ended up doing all types of adult health nursing. So
Oh,
nephrology, very adult health, long-term care, geriatric, gerontology, very long, very adult health.
iba-iba talaga 'pag
Oh,
achiever, eh.
med surge, and I do it for the learning. I don't know why I like doing it. It's just me as a book nerd. As
Mhm,
a book
mhm,
nerd
mhm.
only. I
Oo,
really
magaling.
enjoy learning the different nursing styles, nursing tips, tricks. Um, I don't know, it just feels like an art. That's what they say, 'di ba? Nursing is an art.
Nursing is an art.
The art form is knowing when to turn off your sedation and to intubate and to extubate at the same time. When
Mhm,
somebody
okey.
has to extubate, oh no, you have to extubate, but they have to be sedated. They have to be off
Oo.
sedation. But when they come off sedation, they are a RAS or your agitation scale. They're a RAS of +4. They're very combative. They're pulling at everything. Oh, this is no good. I'm just gonna go back on the sedation.
Balik
And
mo.
then you've delayed your extubation. So
Oo,
there's an art in that. There's an art in your wound care and how you wrap it, how clean it is. There's an art in everything. Everything.
oh, my rapping is
That's the
very
fun part,
bad.
I would say. Yeah. That would be the fun part of the nursing for sure.
Oo, alright.
Mhm.
Alright, so that's it for our 1 hour and 30 minutes, I think. Thank you, Kuya Rob, again.
Oh,
Maybe
of course.
next time, you'll grant me again another, time
Okay. If
to
you're
kwentuhan.
Yeah, if you maybe I can be the what is this? I'm your third guest. Maybe I'll be your
Oo.
sixth guest.
Oo, or regular na
Oh,
ano,
regular?
regular
My
na
goodness, I'll
kasama.
run out. It'll end up being like I'll end up teaching. I'll end up giving education about
Oo, 'di
certain
ba?
things.
Maganda 'yan, eh.
You could. You could. Oh.
Alright. Thank you, Kuya Rob.
Thank you, Franz. Thank you very much. And thank you, everybody,
See you.
for listening.
Thank
Yeah,
you.
thank you. Do I log off first? Okay, I'll log.
Alright, 'yun si Kuya Robert. Nai-inspire ako sa mga sinasabi niya, eh. Naintindihan ko naman, 'di naman ako ano, siyempre English, naintindihan naman natin. Alright, so ang takeaways ko lang sa mga sinabi niya is, for the new grads or sa mga papasok sa ICU, hindi naman kailangang kayo yung pinakamagaling, sabi niya. Just take time to just take time and ask a lot of questions. And then unahin natin ang humility at pakikisama. Oo, so sa mga especially sa mga nag-aaral pa, sa mga nursing students natin, hindi ka talaga matututo kung hindi ka mag-ask or you do not volunteer, hindi ka tanong. So, sa student ka pa lang nakikita na 'yan ng mga teachers natin, eh, at tapos ano 'yun, ma-a-assess mo na ang sarili mo kung ikaw ay assertive or palatanong ka. Kasi dun mo mabu-boost or mafa-fast track yung learning gap na kailangan mo from, the theory books to the actual na work ng isang nurse. So tama, humility and pakikisama, that's a very Filipino thing. Pakikisama, I don't know if, may English translation ang pakikisama, pero that's a very Filipino thing na kahit sino man or ano man ang narating mo dapat may pakikisama pa rin. Especially sa ating mga, experienced nurses and, sa mga nag-aaral pa lang na 'wag masyadong mayabang, 'di ba? Ah, Siyempre meron pa ring mga ganyan and, ah, idol si Kuya Rab kasi despite sa mga negative experiences um, na-experience niya nung nagsisimula pa lang siya is na-convert naman niya into positive and he is inspiring new and upcoming nurses to be great just like him, di ba? Alright, and that's it. Nakaka 1 hour and 30 minutes na nga tayo and good day sa ating lahat. That's the end of our special episode, first special episode sa ating Unconventional Nurse Podcast. And abangan nyo kasi may double header tayo ngayon. May second guest tayo mamaya. Isa naman siyang clinical instructor. So abangan nyo, ipopost ko kung sino siya. So thank you and goodbye.